Hi everyone, my name is Nicolette Yates, and for my Exercise Science 486 video, I will be discussing anxiety disorders, more specifically an explanation on anxiety disorders and a sample case study of a client who has an anxiety disorder. So what you'll learn from this video, you'll learn what anxiety disorders are, causes, common examples, how common they are in our country, signs and symptoms, as well as medications and treatments. As for the sample case study, you will learn risk factors to exercise with someone with an anxiety disorder, special things to consider with exercise testing, and as well as several exercise prescriptions following the FIT model for someone with an anxiety disorder. So what are anxiety disorders? Well, anxiety is considered a normal human emotion at times. It is an appropriate reaction to the stressors of our everyday lives. However, when anxiety becomes chronic, severe, frequent, high in intensity, and/or disruptive to daily functioning, it is then said to be considered a disorder. Anxiety disorders encompass a large amount of more specific disorders and illnesses. That's just the broad term for the more specific illnesses. Anxiety disorders can be caused by environmental factors, genetic predisposition, traumatic or stressful life events, or altered levels of neurotransmitters. However, it's unclear whether these altered levels of neurotransmitters cause the disorders or if they are a consequence to an already existing anxiety disorder. Said neurotransmitters include norepinephrine, epinephrine, serotonin, dopamine, and gamma-aminobutyric acid, which for the rest of the video I'll just refer to as GABA. Common examples of anxiety disorders are social phobias, panic disorder, obsessive-compulsive disorder, or OCD, post-traumatic stress disorder, PTSD, or generalized anxiety disorder, GAD, which is what I will be referring to it as for the rest of the video. Having an anxiety disorder increases one's risk for other chronic conditions or risk factors, such as an increased risk for smoking, alcohol abuse, sleep disturbances, or physical inactivity. How common are they in the United States? They are among the most common disorders seen in medical practice. About 18% of adults have some type of anxiety disorders, but they're also considered the most underrated health problems, and they often go unrecognized, so that 18% is probably actually a little low. 18% is just what is definitely recorded. Furthermore, these disorders cost the United States around $42 billion a year, so they're pretty expensive to treat and pretty common. They come with a lot of physiological symptoms as well as other symptoms. Physiological symptoms include increases in blood pressure, resting heart rate, perspiration, and blood flow to major muscle groups. Other physiological symptoms include heart palpitations, chest pain, tachycardia, shortness of breath, muscle weakness or muscle tension, and nausea. Other symptoms include excessive worry, excessive apprehension, excessive fear, and excessive uneasiness. However, those symptoms are sort of harder to define because the line between excessive and non-excessive is a little blurred. It's not quite black and white, so it's hard to say whether someone definitely has those symptoms versus definitely does not, whereas the physiological symptoms are much easier to measure. Anxiety disorders are mainly treated by medications. There are three main classes of anxiety medications. They are SSRI, SNRI, and benzodiazepines. The mechanism of action for SSRIs and SNRIs are unknown. However, benzodiazepines act by diminishing neural hyperactivity by increasing the GABA neurotransmitter. All three classes come with several side effects. For the SSRI, a weight change or fluctuation is likely, headaches, fatigue, dizziness, and insomnia. For the SNRI, sweating, increased heart rate, dry mouth, and constipation. And for the benzodiazepines, drowsiness, dizziness, decreased alertness and concentration, as well as an increased fall risk, especially the elderly people with anxiety disorders. Several examples, which are all very hard to pronounce, so bear with me, of an SSRI are paroxetine, sertraline, and citalopram. For an SNRI, desvenlafaxine, duloxetine, and venlafaxine. As for benzodiazepines, several examples are lorazepam, diazepam, and alprolizam. Other treatments for anxiety disorders. Exercise is one of the most important things for someone with an anxiety disorder. However, best results are obtained if exercise and pharmaceuticals are combined. There are also many different types of therapies with a counselor, just with anyone who can help, who are proven to really help people with anxiety disorders. The effects on the exercise response with someone with an anxiety disorder. Anxiety disorders do not typically alter physiological changes to exercise. However, psychomotor retardation is not uncommon, so that's the slowing of motor movements and reaction times. Benzodiazepines specifically are associated with profound psychomotor slowing and impaired coordination, so that's the slow motor response and reaction times again. This is especially true following initial administration of the drug or the sudden increase in dosage of the drug as the body is trying to adapt. Therefore, gathering a medical history and a list of current medications is very important before starting to exercise or before prescribing an exercise prescription or program. There are also several other anxiety drugs that may reduce functional aerobic capacity, affect perception and coordination, or reduce the desire to exercise. It's important to bear in mind that with or without medications, typically those with anxiety disorders will already have a reduced desire to exercise. They're either too nervous, too anxious, or just completely unmotivated or apathetic. So for the sample case study of someone with an anxiety disorder, we have Amanda Wilson as our client. She's a 27-year-old female diagnosed with generalized anxiety disorder, similar to that of her father. She is a cigarette smoker, and she's been relatively inactive since her diagnosis 2 years prior. Despite her inactivity, she remains at a healthy BMI percentage of 22%. Her blood pressure is 142/90, her total cholesterol is 170, her HDL is 50, and her fasting glucose is 88. Due to her anxiety, Amanda faces excessive worry when it comes to leaving her house and being active in a public setting. It is now hard for her to briskly walk more than 10 minutes, and her strength is severely lacking. This only adds to her anxiety. She uses cigarettes to attempt to calm her nerves, but wants to eventually quit. She no longer looks fit like she did when she played sports in college. Her eventual goals are to increase cardiovascular fitness, as well as increase her muscular strength so she has a healthier appearance. Amanda's risk factors. She presents with 3 risk factors, the first of them being that she is a cigarette smoker, her second being that she is physically inactive. She does not meet the recommended weekly recommendations set forth by the ACSM. She also has high blood pressure. She is in stage 1 hypertension with her blood pressure of 142/90. Because of these 3 risk factors, she needs a physician's clearance before beginning an exercise program. Exercise considerations. The psychological and physical benefits of exercise can greatly help reduce anxiety, and this is not limited to aerobic forms of exercise, so things like resistance training, flexibility, or maybe even balance exercises are all encouraged to help reduce anxiety symptoms. As mentioned previously, the best results are from exercise combined with medications. Some more considerations for someone with an anxiety disorder. Those with an anxiety disorder can typically follow the same prescribed guidelines for the general public unless they're affected by another chronic condition. So those with other chronic conditions should follow the guidelines for that condition. In Amanda's case, she suffers from hypertension, so her exercise testing and exercise prescriptions are tailored for someone with hypertension while keeping in mind her generalized anxiety disorder. When creating an exercise prescription for someone with an anxiety disorder, it's important to keep several things in mind. Definitely want to keep your goals achievable, encourage the process of change and growth instead of just meeting numerical goals. You want to rejoice in the client's self-discovery. It's a big step that they're coming to you in the first place. It probably took a lot of guts and a lot of convincing for them to approach you, which needs to be honored and recognized. It's also important for the exercise prescriber to provide a lot of positive feedback, as most of your clients lack motivation. Also hugely important to emphasize interest and enjoyment, as most of the clients are apathetic or extremely nervous. In addition, you want to seek your clients' feedback to help plan and obtain better results. You want to know what they like doing so you can try to incorporate those in your prescriptions. Encourage leisure time physical activity. They're more likely to do it if they have fun with it. You want to let their internal voices be heard and not drowned. You also want to encourage social interactions with others, but do this with caution. Chances are, due to their anxiety disorder, they are very timid about exercising in public, just as Amanda admitted that she was. Therefore, the home environment may be more beneficial to start out with, and as they become more comfortable and more confident with their bodies, incorporate a more public setting. Definitely want to stay away from gyms in the beginning. Those are said to be the most intimidating for clients who are intimidated. Exercise testing. Due to her 3 risk factors, it should be done with a physician present. Some examples for an aerobic test would be the 6-minute walk test or the 3-minute step test. For a resistance test, a 3-rep max test for the back squat and bench press. And a flexibility test could be the sit and reach. Exercise prescription. I've outlined an aerobic, resistance, and flexibility prescription for Amanda, each following the FIT principle. So her aerobic prescription should be performed 5 to 7 days a week. She should have the intensity being self-paced, as she seems to be pretty debilitated at this point, but she should try to progress to a moderate intensity. Her main goal is 150 minutes a week at the minimum. So each time she exercises, it should be at least 30 minutes. However, if she can't do 30 minutes right off the bat, she is more than welcome to start with several 10-minute bouts of exercise throughout the day if needed. She can do any exercises that involve large rhythmic motions of major muscle groups, so walking, biking, or swimming are all acceptable. Her resistance prescription should be performed 2 to 3 days a week at 60 to 70% of her 1-rep max. She should perform 8 to 12 reps and 2 to 4 sets and do exercises that hit all of the major muscle groups. She can do free weights, body weight, or machines. Her flexibility prescription should be at least 2 to 3 days a week. This can be met in the warm-up and cool-down alone, or she can just set aside time aside from her aerobic or resistance prescription and just work on her flexibility. She should do this to the point of slight discomfort or tightness, with 10 to 30 seconds of each stretch and 2 to 4 reps of each stretch. These stretches can be static or dynamic. If incorporating them in the cool down, she should either lengthen time or lengthen reps or include many different stretches. Due to her hypertension, she wants a longer cool down to avoid post-exercise hypotension. So in conclusion, anxiety disorders are very common in the United States and greatly increase the presence of other chronic conditions. There are many pharmaceutical options available. However, they won't cure the anxiety alone. Exercise, also not enough on its own, can greatly diminish the symptoms of anxiety as well as help to modify the modifiable risk factors or chronic conditions brought about due to anxiety. Thank you.